Hi, everyone. It is World Mental Health Day 2023, and I'm delighted to bring to you this conversation with some amazing folks in the mental health space. You're going to meet writers, counselors, folks working with young people, with the queer community, people with lived experience, and we're going to talk about mental health and storytelling. What do stories have to do with mental health? How can stories help our mental health? What is narrative therapy? We're going to put these questions to our amazing panelists. So let me bring them on with no further ado. If I can remember how to do this. Sorry, one second. You're going to probably see them all on the screen at the same time because that is my tech savviness. Hi, everyone. Thank you for joining us. We have Pranab, who's a queer affirmative wellness practitioner at the Keshav Suri Foundation. Pranab, thank you for joining us, and you can give a wave and a hi, I think, in intro. Patty Gonzalez, PhD, is project director, the Youth Mental Health Group at Sangat. She's a known mental health advocate. And Patty, you do a lot of work with young people. Very interested to talk to you about storytelling and the impact that can have. Thanks for joining us. Okay, I feel like I've put everyone on the spot to wave, and because I put you all on the screen, but you can do a group wave. Manjari Indurkar is a poet and writer from Jabalpur. She's the author of It's All in Your Head, M, fantastic work, and the forthcoming poetry collection called Origami Eye. So, Manjari, thank you for joining us, and congrats on both works. Thanks for being here.
Thank you. Hi,
And
everyone.
and Shubrata Prakash is a well-known mental health advocate, a friend of the Health Collective for years and years and years, the author of the D Word. She's also a government servant. She's an IRS officer and has set up a peer support group. She is someone with lived experience as well of depression, anxiety, and ADHD. Shubrata, thank you for being with us today.
Thanks for having me.
Okay, so I'm just going to kick off straight. I actually probably should introduce myself. My name is Amrita. I'm a former journalist and I'm an author. I've written 2 novels. I've co authored 4 books to do with mental health, co authored with psychologists and psychiatrists. And I actually set up the Health Collective several years ago to focus on stories of lived experience, to focus on stories to do with mental health and mental illness from an India lens, because that's the gap I saw as a journalist at that time. And I think my overarching identity, as I'm going to put to this panel, is I was a reader first. I really do believe in storytelling. I think as a journalist, you see the impact stories can have every day, and certainly the impact they can have on you as an individual. So let me open this by asking you all, maybe Patty first, and we can go around. What do you think stories really have to do with mental health? What's the connection there? And what are some of your thoughts on the impact?
Great, thanks, Amrita. So, I mean, in short, I think, mental health and stories has everything to do with storytelling. And, as I think everyone on this group also can attest, stories are probably one of the most powerful and universal ways you've talked about your, personal experience or things you've encountered, or it's been one of the most powerful ways you've been able to communicate a complicated topic or a complicated situation or experience to someone else. From a kind of the lens I work in, which is more, I'm trying to really understand where do stories impact on people the most. So, more recently in the last few years, there's a lot of research emerging that storytelling can be quite a powerful tool in addressing not just stigma, because we hear about stories often in the context of a way of building awareness or reducing stigma, but also like tangibly as a way of actually improving somebody's mental health, as a way of improving help-seeking behaviors, learning new coping strategies that you may hear or read from someone else, and also really importantly finding connection with other people and potentially even reducing or improving people's mental health symptoms. That's it, just a quick blurb there.
No, that's fantastic. Connection, improving symptoms. And I'm going to actually come to Pranab to talk a little bit about storytelling from the narrative a psychology point of view. But Manjari and Shubrata, as folks with lived experience who have chosen to share your own stories, which I do say it still takes a lot of courage in India of 2023. So hats off to both of you. We know for a fact that your sharing your stories makes it easier for other people. It opens the space up in some ways to have these conversations. Manjari, you first, and then Shubrata. What are your thoughts in terms of storytelling and with that lens as well?
I mean, I think that it's not just about mental health. Like, all my learning in life has come through reading. So, like, growing up in a very small town where, like, life was sort of, ghettoed and, like, sheltered from every experience that, like, a big city kid would have. I think literature was the only access I had to the outside world. And so, like, ideas like feminism, or even like something like, I when I started getting into therapy, I realized that I had like zero resistance towards it because I had already read. And this is not even nonfiction, I'm talking about like novels. I had read novels where characters were in therapy. So, like, like in my head there was never this block towards anything. So I think stories are important told in any way, shape, or form. But other than that, my experience of sharing my own stories, be it through the book or like through the essays that I had been writing before that, uh, a lot of people reached out to me saying that, like, hey, this is something that I also experience. I just didn't know that, like, other people also go through. Or like, hey, like, I thought that only I was doing this. So like, one of the things that I struggle with is trichotillomania, and I had written about that. And like, a sea of people I already knew in life, they reached out saying my sister does this, or like, I've been doing this with whenever I feel anxious, and I just did not know that this is a problem, or like, this is a condition. And so yeah, I mean, I don't know, like, it's one of the only, like, one of the major ways in which we can shift the narrative and, like, de-taboo, I don't know if that's a word, but destigmatize this entire conversation around mental health.
Yeah, 100% should be a word, deep taboo. And you're right about fiction as much as non-fiction. I think that's something that all readers would agree with. I mean, it opens our minds in some ways. It can teach us empathy. We know that relating to characters, I'm just reading this research, your brain releases oxytocin, which we all know is associated with empathy when you're connecting with a character. I'm certainly a fan of everything you're saying right now, Manjari. Thank you so much. Shubrata, you're back. Can you tell us some of your thoughts as well?
Of course, I feel that storytelling is really, really important when it comes to mental health from various perspectives. For instance, there's so much of stigma around mental health. So when you start talking about disorders like depression, the moment you mention the D word, the title of my book, people kind of run away. But if we use small stories to talk about what depression is like, that is something that opens up the conversation. And in fact, I have used that in my book. Like, the first chapter is just about these small stories of different people of different age groups, different backgrounds, who have different kinds of symptoms of depression. So this is something I thought would be very useful to kind of reel in the readers, because otherwise, the moment you mention anything about mental health, people run in the other direction. And also, I have narrated my own story in the book. So that's the best way to kind of tell people what it is exactly like. If you tell someone that, okay, it's difficult to get out of bed and your mood is not good, people will be like, okay, what's the big deal? But when they hear it especially in a first person narrative, like the way I have put in my book, so people kind of like maybe develop some kind of empathy towards the character that's being spoken of, in this case me, and would probably see things from the survivor's perspective a little more. So whether it is my book, whether there's so many other books on mental health and so many blogs, so many articles, so many places you will see, I think for a sensitive and stigmatized topic like mental health, probably these small stories, these, which capture the various nuances and aspects of this disorder, or any other disorder for that matter, which is stigmatized, would really take the conversation a little along, and would open up more discussion on the topic.
And it does also help us realize, Pranab, to bring you in here, that we might not be as alone as we think we are. Sometimes when you hear from real people, or you read fiction, and you resonate with a character, resonates with you, because I do feel mental health, or rather mental health conditions, by the very nature of what they are, plus the stigma that our panelists are referring to, especially in, let's say, in India 2023, there's still very much this feeling that you can't always talk about these things openly, right? So hearing somebody else's story, it helps you feel a little less alone. Can you share a little bit about your thoughts?
Yes. So as all the panelists have already said how stories are very helpful. And yes, it has seen greatly in the group therapies also how story inspires somebody else. Stories and the narratives what they have formed. And at the same time, as I'm counseling, people from poor community who are considered to be a marginalized community or sexual minorities, we form these narratives, whatever we see, and the stories are made with the social construct. So what usually happens with the queer community over here is that there is clash between that, so the personal narrative what they have and the societal narratives what they have. And as we are staying in this society which we are so very much part of, and somebody from the queer community is still having those kind of narratives and trying to gain those achievements, it creates a lot of clash, and that comes up so strongly in the stories. As I always start my session, if I have to start with the narrative therapy, please tell me about your story, how it is, and they go on. And when the reflection of the stories happens, then somewhere they feel that affirmations. Yeah, I've been understood. I've been visibilized. What I am. So that's what great thing and such a strong thing what stories play in mental health counseling as well.
No, 100%. And Pia, thank you for your comment. Pia saying it's a very relevant discussion. We need to prioritize mental health. And that reminds me, wherever you're watching this, please feel free to drop in your comments or your questions. It does help us feel like we're not talking into the void, though I know many of you will catch up on this later. Pranab, let me pick up on one thing you said, because you work a lot with the queer community, you work a lot with marginalized groups. When we talk about narrative therapy and when we talk about the stories we tell about ourselves, there is a direct link with our own sense of self, with our own self-esteem sometimes. How do you look at storytelling from that point of view, using your hat as a therapist and counselor? Pranab, can you hear us? Can you hear me? I don't know if I went on mute. Pranab, can you hear me?
We can hear.
Okay.
No, I think there is a connection issues or something. I didn't hear your question.
Okay, I'm gonna just Patty, can you hear me by any chance? Okay, can I ask you a question a little bit to do with what you're hearing from young
Sure.
people from your work with young people, and I'll just try and reconnect with Pranab on the side as well. Storytelling. I know you've also done work on gaming. Can you share with us a little bit about that?
Sure, happy to. And I think there's really gonna draw on a lot of the points that were just shared because it resonates really very much with young people that we work with. So these are a few sort of anecdotes around what especially younger people like to hear or want to see in stories. And I think I don't know how others in the group feel. I think at least what we hear from young people is that they really much prefer real stories rather than fiction, and that it doesn't have to be a very polished experience or it doesn't have to be very refined in how a story is shared, but the fact that it's come from a real person who's had that experience tends to be quite important. And also that stories don't necessarily, or in fact, more often than not, should not come from celebrities or from people who have for example, a lot of access to mental health support or resources. So that those are a couple of things. A few other things in terms of the, like, I would say, getting into the nitty gritty of what types of narratives. Again, I think really resonates with what's been shared just now is we hear a lot that young people don't want to hear stories where there's a very clean kind of end, or everything gets tied up quite sort of neatly. So, for example, recovery is not something that is an end point, but that they want to hear stories of someone's journey and the recovery process, and not necessarily, this kind of either somebody is unwell or they are well. But they want to know the details. They want to know how someone's doing in their journey of their mental health. And last couple of things I think again which stood out is that language really matters, and it's quite funny that it was mentioned around. I think Shubrata mentioned around what people call the D word or any other mental health problem, depression in this case, but that young people at least they want to hear words like experience, so not a problem, not a challenge, not a symptom. And I think drawing on the point around representation, that They want to hear stories from people from different genders and from different kinds of communities and representation. And that age doesn't matter. A 16-year-old could read a 60-year-old story. Where you live doesn't matter. But that, your kind of these deeper parts of who you are being visible is really important in reading stories. So those were just a few things and that have stood out over the last few years, at least working with younger folks.
That's really interesting, and I know it's what you said. You don't need to impose this kind of arc of like this is the good and the bad. They want to hear the real experience. Pranab, let me try you again. I'm hoping that you can hear me. I did want to ask you a little bit about what you're seeing in the queer community, especially because the work you're doing and what we see with storytelling and the narratives we build up about ourselves definitely have a link to self-image, self-esteem, and the rest of it. So, can you tell us a little bit from that point of view?
Yes. So basically, the main issues with the community, what with my experience is, there's a lot of the self acceptance issue, because the social structure is not accepting them the way they are. So this comes very strongly in the story that and self acceptance, that okay, I belong to a certain spectrum. For example, I belong, so I am gay. So to just had that self acceptance is so difficult for many of us and many of them. And what happens is that through narrative therapy, we externalize the issues what they have, and we say, see, dude, the issues are issues, the problems are the problems, and they are separate than you. You are not the problem, and the problem what you're having is due to the societal narrative what is there outside, which is way rigid, which is so difficult, that so many people from the heterosexual community have to face. So the question here arises, where do the poor people stand in this society? So that's what lot of talking happens in the story, and lot of thing, just realization that when one, or for example me, when I belong to poor community and I have my thinking process and narrative just like a heterosexual people, then I have to be very much aware, because my achievements, my milestone will be very different than heterosexual people. So this what one realization goes very strongly in the narrative therapy.
Yeah, and also I think that really links nicely to what we're hearing everyone say about why representation matters, right? Because when you don't have those diverse and inclusive stories out there, you can feel more and more isolated and otherized. Pranav, that's really helpful. Thank you so much. Manjari, I want to ask you a little bit about what's changed, do you think, since your book came out? Because you were very honest in that book. It was a very moving and brave portrayal. Have you found other people coming up to you to share stories? I mean, that's something that Subrata and I talk about sometimes. So all of a sudden you become that kind of that go-to person as well. The pros and cons of that we can weigh on later. But have you found that your book has opened up spaces for other people to share?
Yeah, a lot of time this happens. Like I get messages on Instagram that end up in my others folder or whatever it is called on Instagram, and like these are mostly same stories that uh, child sexual abuse experience, or and which is something that people still find it very difficult to share with anyone. But because I've experienced that and I've written about it, so people feel a little open about it towards me, and sometimes I feel a little lost because I don't know how to help these people out, except for, I don't want to just say, okay, you should seek out a therapist, or, like do this or do that, because I don't really have like a guidebook or anything for them. So I end up like sometimes talking to them and sharing a little bit of my journey, but also I can't fail to acknowledge that I do come from like a relative space of relative privilege. And so, but yeah, I mean, my book has definitely pushed a little bit of the conversation forward. Like a lot of people have reached out to me, and sometimes like one time it happened that like a person, she's a teacher, I think. uh, she spotted me at like some event, and she's like, hey, I've read your book and I've put it in my library for other kids to read. And I was like, okay, that's great. And like that's a good feeling that one gets. But I also like sometimes the feeling that I also get when I listen to these people is that while I can listen to them, I don't know how I am helping them, and what after that. Like, do they have other avenues where they can reach out and like seek some help, or whatever it is. Yeah, so
Yeah, I know what you mean, because I think we do. also recognize that, yes.
Yeah, Amrita, can I say something? Sorry, I'm butting in, but please excuse me. This is
Please.
ADHD, and I had two, three thoughts from what the others said. If I don't say this out now, I'll probably forget. So, one of the things that both Pranav and Manjari said that I really wanted to take up right now is the stereotypes. Like, and the perspective of privilege. So, for instance, this is something I've tried to address while writing my book, like the stereotype of someone who has depression, and it's like it's a choice, and they don't want to do something, and they're just lying in bed because they don't want to do anything. So if you just put it like, no, someone with depression doesn't like to lie in bed, they want to do things but they are not able to. So if you just put it in these bland words, people probably don't accept this, or they don't identify with this, or it somehow seems to be some kind of an excuse. But if, like the way I've written in my book, if I've written about so many different days, that okay, on this day I tried to do this in this fashion, but this did not work out because I had depression. Then on another day, I tried this, but even this didn't work out, or this worked to a certain extent, but not beyond that. So that kind of probably would help to break the stereotype that someone with depression doesn't want to do anything and it's just an excuse. That's the first thing. The second thing is also the whole idea of privilege. Like depression is something that people who have privilege, they should not have depression because their life is better than so many others who have it worse. Because I'm sick of hearing this being told to me that you have everything, and look at others, they have it worse. It isn't that. I mean, privilege is one thing, but even someone who has relative privilege in this world can also get depression. So probably these stories, like the way I put it also helps to tackle this stereotype. And okay, there's something I actually forgot. So let me come back to it the second time around.
No,
So
for sure. Those are good points. I think when we talk about privilege, acknowledging that, for example, we can have this conversation, or for example, we can access resources that may be unaffordable for so many people in this country. That's something, Shubrata, you and I have also spoken about. But I know what you mean, because you have this kind of stereotype that mental illness is something that happens to rich people, privileged people, Western people. When we started, that's what we heard a lot of. That we don't have this problem in India. The more you talk about it, the more you're importing these West, which is why I think you need to see more stories from this country, from all of the cities and areas in this country. But let me ask you all
Can
one
I
question.
just
It's World.
Can I just
Yes,
add
go
one
ahead.
point? Yeah. Since we were on the subject of privilege, so by privilege, I also mean that it's not just about money and access to resources, because access to resources is also hampered by. So, for example, I was this in 2018 or 19, I think I was on a panel in somewhere in Mumbai. And like these two very young 16, 17-year olds had come, like these are school kids, right? Like 11th standard, 12th standard, something. And after the conversation, like they come up to me and they're like, can you tell us how do we convince our parents that we have depression and that we need to seek help, that we need therapy? And I was kind of like dumbfounded, because on the panel I was talking about how I had access, or my parents were open to letting me seek therapy, or like this mental health conversation was not as stifled in my house, and that really genuinely helped me access these resources. And like these kids were like, so what did you tell your parents? But the thing is that I was born into this family where my parents were rather open people, and you may have money but you still may not have people like that around you. So I think like privilege is also support system, the people around you. It's more than money, is all I wanted to say. Yeah.
No, 100%. And I think what we also need to understand is that it seems to be cutting both ways. Like I remember doing a bunch of interviews, right after Deepika Padukone came out and talked about depression, and asking psychiatrists, like, did you see an impact? And a lot of them were saying, yes, it's actually fantastic. She did it. But, and actually, Patty, I think it was Dr. Patel who told me this in an interview. He said, the flip side is you don't want to reinforce the stereotype that it's only something that impacts people who are celebrities in this case, which is what the media had picked up on. That seemed to be the angle. But let me take that opportunity to ask all of you, and Manjari, will start with you and then go around. Today is the day that everyone cares about mental health, right? I mean, it's the one day in the year where you can be guaranteed that these conversations will happen. What do you tell, or what is your sort of take for people who are like, look, we don't really have a mental health problem, we don't need to care. Why do I need to care about somebody else's story? Why does it even matter? What would your response be? And I'm coming to all of you with this slightly mean question, but it's a fact. A lot of people think it's not going to impact us, it doesn't affect our families, I don't want to discuss it. Any suggestions or any reaction to that?
One, how do you know that it is not something that you are going to deal with, or like somebody around you, your best friend, your mother, your, I don't know, anybody, like your child is already dealing with? I mean, if you haven't had the conversation, then you're just assuming that like this is not a problem. You don't really know anything, right? So how would you, I mean, what I don't get it is why would you not want to know about something that is happening to so many people? I keep hearing that like, oh, like this generation, like millennials and whatever generation comes after us, Gen Z and Alpha and whatever, we are all like too privileged and too like snowflakes. I think snowflakes is the word often thrown around, that like, yeah, you guys have all the problems and we were walking 10 kilometers to our schools and we didn't have any problems. But you guys did have a lot of problems. Like my mother gets a panic attack when she's like left alone. She just doesn't know that it's a panic attack. So does that mean she doesn't have anxiety? Of course she has anxiety. You guys just did not have the language. If we're trying to give you some language to acknowledge what is happening, why don't you want that? Because I mean, you already don't know what the other person in your life is going through. So I mean, listening is always a good thing.
Yeah. Pranab?
Yes, so basically the stigma which everybody have spoke about that mental health has have really don't allow people to go and speak about it. Like something is wrong with me because we are in staying in the society which has to be perfect, right? And being perfect is such an irrational idea. I want to be perfect. So anything which goes wrong, it's like, hey, oh, something is wrong with me. There is totally wrong something in upbringing. So yeah, as everybody said, we have to be very kind to ourselves first of all, in terms of and talk about mental health, and lot of things are required to be spoken in the general public about mental health. Thank you.
No, I love that. And be kind to ourselves. We always forget this somehow, right? When you're doing all of these, I think that's a really important reminder. Sometimes the stories help us give the language. Shubhrata and then Patty, what are your thoughts in terms of people who just like, we don't need to care? Shubh first and then Patty.
Well, if I started talking about this, I would probably need, 50 of these meets to talk about this particular aspect, because generally people, the society believes that people who have mental disorders like depression or anxiety, or they are either raving mad, or they are a bunch of privileged people who cannot face their life, and they use these excuses to hide behind that, or they're all drama kings and queens, and all of that does all of those stigmatizing stereotypes, they all exist. But what happens is that, who do they turn to when they get a problem? Who do they turn to when someone in their family, or when they have, it's people like you and me, people like us, who have been speaking about it, who've been visibly seen, sharing their stories. And we are the people who they turn to when they have to reach out for help, because we know how to get them into the system, how to get them to access what kind of help. And that is one of the reasons I just keep saying, because as someone said, that you're not alone, and you also keep saying this, Amrita, you're not alone, and that's it. So it doesn't matter whether they whatever they call me, drama queen, privileged, and spoiled, or entitled, whatever they call me doesn't matter, because ultimately when they need someone, I'm there. And that is why maybe they don't feel so alone, if they see a face like mine, if they see someone who's just a, I'm no celebrity, I'm just a simple person, and if I speak out, uh, probably that gives them some space to come up and speak to. So this is, I think, one of the reasons why I do all the mental health advocacy work that I do.
Yeah, and I think that's actually quite a mic drop. Like, who do you come to when you need to have these conversations? I love it. Patty, your thoughts?
Yeah, I don't want to repeat anything. I 100% agree with the comments shared. I think the only thing maybe to share is like, for often, I think if you're thinking, what does this have to do with me? I don't have a problem right now. There's a very, very good chance you will have a problem at some point in the near future. And, we live in a very, very difficult world right now, you're bound to be impacted even just by the things you're seeing or other people's experiences happening around you. I would, not be so quick to discount that this isn't a challenge for, I mean, for everyone. Um, and just to say, some life experiences or mental health problems, if you have one, they might be more challenging than others, and at different points in your life, and learning from others' experiences, I think in this regard can be quite helpful. And in terms of, I think, listening, and this was brought up in the comments just now. There's a very real ROI I feel in building this skill and being kind, whether it's at a personal level or community level and organizational level. Even if you're not compelled to do it for any other reason. And it's really simple to be a good listener, and it just means, listening to someone else without judgment, being patient, and you absolutely don't have to have the answers. You don't have to offer any advice at all. If frankly, you should, actually like tell yourself not to give any advice when someone is sharing an experience with you. And even just, I mean, speaking very personally, when I've struggled myself in the past, I think I found it most difficult when people would ask me the question in this way, ki, like, tum theek ho na, or, you're okay na, rather than just saying, like, how are you? And like, leave it open. Don't put any, don't place any value or judgment in asking that question. That's basically all you need to do as a good listener. And some other really good advice I got over the years is also, how do you respond when someone shares a story with you? Is you can just say, thank you so much for sharing that with me, or to acknowledge that, maybe you've had, like, thanks for sharing, that sounds like a really difficult experience. That's it. You don't have to offer anything more than that, but be kind, be empathetic. And that's all it takes to be a good listener, and kind of like, I think, do your bit in supporting others. And I do think, I 100% agree with Shubrata's point on, if you talk more openly, people absolutely will approach you. So, you don't have to shout it from the rooftops, but I think, having these good kind of positive, non-judgmental, open reactions, more people will naturally gravitate and feel comfortable to share with you if they actually are struggling or they need help.
Yeah, and we do say, like, you shouldn't feel the pressure to share more than you want to share. We do think sometimes, it's harder to have these conversations in our homes, in our offices, than this kind of panel, ironically, even though you would think it's the opposite. I really, what you all are saying is really resonating. I have one last question, but I want to thank our viewers. I think LinkedIn is popping today because we're getting most of our comments on LinkedIn. Thank you, LinkedIn user. That's a lovely comment. Thank you, Pia, Samrid, and Payal. I'm going to keep showing your comments, finding this discussion very insightful and agreeing we need to prioritize mental health. I'm going to go Pranab, Patty, Manjari, and Shubrata in just no order whatsoever, so you can break that order. If you wanted to, like, if you had the power at this point, it's 2023, October 10th, by next World Mental Health Day, you could change one thing in India, one myth. Let's be realistic, one stereotype. What is one myth you would like to bust? I'm saying one. You can say two or three. We have a few minutes. I forgot the order already. I think it was Pranav first, and Patty, Manjari, and Shubrata. But anyone, what is a myth you'd wanna bust?
Okay, so one of the I will go big myth is that as a mental health professional, people have that, oh, you can read our minds. No, we cannot. It really takes a lot of work to know a person who is sitting next to us. Yeah, we cannot read your minds, and anybody can get mental health issue. It's not just with the adults, as even Patty and all others have said. Right, from children to adolescents, anybody can get mental health issues. So these two are the myth which I would really like to stress upon for this on this platform.
That's actually really helpful. Yes, you're not psychic, and anyone can have a mental health issue. Anyone else? In the order I forgot.
I've got a really, I mean, a simple one. I think I was next. But and again, I think, in people, including, I agree with Pranav, like, even mental health professionals themselves struggle with this one, which is, if you're not feeling good, don't wait till things get so bad that you're, the recovery process takes so much longer. So don't wait till things are, at a point where you're just like completely feeling non-functional, or things are feeling very, very out of place. So, get help early, talk to somebody early in your process. And, this, I think we all keep saying, like, nothing's wrong, nothing's wrong, and, I'm okay, or I can deal with it. But to ask yourself also, is everything feeling right? To me, am I feeling like I have the resources to tackle challenges I'm facing? And if you feel your reserves are a little bit diminished, there's lots of ways to replenish them, and like talking about it, seeking support, but do it early, don't wait.
Perfect. Next, Manjari or Shubrata? There's no order.
Yeah, sure. So I think one that I would like people to stop saying is that depressed people or are lazy, because they like tie to their beds, or they just don't want to move, or like are either eating a lot or not eating enough, or not taking care of themselves because they like themselves the way they are, or because they just like lazy. So no, they're not lazy. If they had the energy to take a bath, they definitely would. If they had the energy to move, they definitely would. If they had the energy to cook, they definitely would. Like, what people don't realize is that like it takes up, everything takes up, like that spoon theory that I'm sure like a lot of people here are aware of, that like everything that you do, it takes up, like if you have like 100 spoons, then like getting out of your bed will take one spoon, taking bath will take another spoon, and basically it will just diminish your energy sources, and we have those limited energy sources. And so I would like people to just be kinder to other people, and just like stop throwing words like, oh, you're lazy, you're not motivated, you're not this or you're not that. I mean, it's none of those things. It's a myth that, I mean, I know, do I
Yeah.
not know that moving and like exercise is going to help with my mental health? Of course it will. But do I have the energy to do that always? I don't. And so it's just a fact that I live with.
Yeah, and I think what you and Patty are both. I mean, it just does resonate. It doesn't take that much to not be judgmental, right? It could just be listening to someone and saying, "I hear you. I see you. I'm sorry for what you're going through." Pratibha, thank you so much. Thanks for watching and thanks for your lovely comment. Shubrata, a myth you'd like dispelled?
Okay, so one of the biggest myths that I would like to address today is the idea that we can think or behave outside our brains, or that the brain has nothing to do with mental disorders like depression or anxiety or anything. I mean, of course, all thought and behavior takes place inside the brain. Disorders like depression are biopsychosocial. So, and that is not an that's not an excuse for pushing pills onto people for recovery. That's not the idea. The idea is that one needs to understand that we all have a brain, and all our thought and behavior originates in the brain. It's firing of neurons, and something happens in our social environment, maybe probably in our way of thinking also, the social and the psycho, and then it affects our brain. But people kind of always try to downplay this, and this is something that I'm just not okay with, because all said and done, we all have a brain and we cannot think and behave outside our brains. So this is one myth that I wanted to address, because I think a lot of stigma, a lot of it, I'm not saying all, because even having a disordered brain is stigmatized, but a lot of stigma and the idea that depression is a choice, and it's laziness and it's lack of motivation also somehow, I don't just I'm not able to figure out or understand why it comes from the idea that are it somehow kind of ignores the fact that we all have a brain and things happen there, and that's the seat of all our lives. So this is one thing, and one of the things that I wanted to just go back to the previous topic that we were discussing, and I just wanted to supplement something like what something Patty said. A colleague once told me that thank you. She said, "Thank you, ma'am, for the work that you do. Because of that, we know who to approach." So it's sort of really touched me, and it stays with me. I've spoken about this a lot of times. So that's why I think we must keep doing what we are doing and dispel all these myths which keep floating around in society.
No, for sure. I think, as Shubrata knows, at least, and Patty, from some of the struggles for keeping the health collective alive, one of the things is those emails we get every once in a while. Somebody will pop up or somebody will meet me at a conference and say, it was a dark time. I showed somebody I care about one of the stories on your site. I think I'm definitely convinced that we need more voices like yours, and that we need more stories. I don't know how we end the stigma, but we will regroup probably sometime in the next year to see what the impact all of your wishes for those myths have. I cannot thank you all enough for, yes. for what you do, how you show up for each other, how you show up for yourselves, and how you all walk the talk. I really, really appreciate you also for joining us today. Thank you so much.
Thank you, Amrita.
Thank you.
Thank
We'll
you.
be ending this live, and if anyone watching later have any questions or comments, please feel free to ping them to us. We'll put them to our panelists as well. Thank you all so much for watching if you have been.